Hello everyone, my name's Katie Murphy. I apologize for the setup I have. My phone was not cooperating, so I had to resort to the next best thing. So I apologize. I know you probably can't read what's on the screen, but I have uploaded a copy of the PowerPoint presentation that you're more than welcome to read along or read on your own free time. I currently work as a social worker at a doctor's office, primarily working with pediatrics, including adolescents. So for my presentation, I decided to do one on STDs and having responsible sex, an overview basically for teenagers. So we'll go ahead and get started. The first thing that I wanted to go over are what are STDs? STD stands for sexually transmitted disease. STDs can be transmitted by various forms of sexual contact, including vaginal, anal, and oral sex. Some STDs can also be transmitted by blood. So for example, sharing needles, if someone is using heroin and is sharing needles with someone, some of these STDs can be transmitted that way as well. There are many different types of STDs. They'll all be discussed throughout this presentation. Some of the various forms of STDs include bacterial vaginosis, also commonly known as BV, chlamydia, gonorrhea, viral hepatitis, including hepatitis A, B, and C, syphilis, genital herpes, HIV and AIDS, human papillomavirus, also commonly known as HPV, and trich. So we'll start with bacterial vaginosis, or again, BV. BV is an infection caused when too much of a certain bacteria change the normal balance of bacteria in the vagina. BV can be contracted by having a new sexual partner or multiple sexual partners, or by douching. That's another way that BV can be contracted. Having BV can increase your chances of contracting other STDs as well. You don't necessarily have to have sex to get BV. BV can be common in women that don't have sex at all. Some of the symptoms of BV. Symptoms of BV can include any of the following: white or gray vaginal discharge, odor, pain, itching inside or outside of the vagina, burning in the vagina or burning while urinating, increased odor after intercourse. Treatment for BV is pretty common. You can either be treated with over-the-counter medications that you can get at local Rite Aid, CVS, anything like that. You can also go to your doctor to be treated with oral medications, antibiotics, that can also treat BV as well. The next STD that we'll talk about is chlamydia. Chlamydia is an STD that can affect both men and women. If left untreated in women, it can cause reproductive issues. In the most extreme cases, it can cause infertility in women. Chlamydia can be contracted by having vaginal, anal, or oral sex with someone else who is infected with chlamydia. Some of the symptoms of chlamydia include discharge from the penis in males, burning sensation while urinating, pain and or swelling in the testicles from males. For women, it may include abnormal vaginal discharge or burning sensation while urinating. Many people with chlamydia don't have any symptoms at all. These are just some of the common symptoms that some people experience, but it doesn't mean that everyone may experience these. So it's very, very important that if you do experience any of these symptoms, that you contact your doctor right away and get an appointment and get checked out. The treatment for chlamydia, again, if you have any of these symptoms, it's very, very important to seek medical treatment right away. Chlamydia can be treated with prescription medication, which can only be prescribed by your doctor. There are no over-the-counter treatments for chlamydia. The testing has to be done by your doctor, and the treatment also has to be prescribed by your doctor. The next one that we'll talk about is gonorrhea. Gonorrhea is a very common STD that, again, can infect both men and women. Infection can be found in either the rectum, genitals, or the throat. It can be contracted in any one of those areas. It's a very common infection among those ages 15 to 24 years of age. Symptoms of gonorrhea. Some of the symptoms that women may experience is pain or burning while urinating, increased vaginal discharge, or bleeding in between menstrual cycles or your period. Symptoms in men may include, again, pain or burning while urinating, a white, yellow, or green discharge from the penis, and or painful or swollen testicles. Rectal infections may also be possible if infected from engaging in anal sex. It can include the following symptoms for both men and women, which may include rectal bleeding, itching, discharge, or painful bowel movements. The treatment for gonorrhea is the same. You have to go to your doctor to be tested. You also have to have your doctor prescribe you medications to treat it. It is a treatable disease like chlamydia, but you cannot, again, go get medications over the counter. It has to be treated by your doctor and also diagnosed by your doctor. The next one that we'll talk about is hepatitis. Hepatitis is a viral disease. There are 3 types of hepatitis, and that includes hepatitis A, B, and C. Hepatitis A is transmitted by with fecal matter to oral contact, while hepatitis B is typically transmitted through the blood, but it can also be transmitted through semen, vaginal secretions, and even saliva. Hepatitis C is transmitted through the blood primarily. It is also common, hepatitis C is common diagnosis among IV drug users who may share needles. So again, individuals that use heroin that share needles, it's a common diagnosis for that population. These are some of the symptoms of hepatitis. Across the board, hepatitis A, B, and C. Many people will go with no symptoms at all, but again, these are just some of the common symptoms that some people may experience. Fever, fatigue, dark urine, clay-colored stool, abdominal pain, loss of appetite, nausea, vomiting, joint pain, and jaundice, which means yellowing of the skin. There's a couple different treatment options for hepatitis. Hepatitis A, B, and C are all chronic diseases, meaning that there is no cure. But it can be managed with medications that, again, can only be prescribed by your doctor. Your doctor is the only one that's able to diagnose and treat all forms of hepatitis. There has been new research trying to find cures for hepatitis. However, there is nothing on the market at this point. There are vaccines available to prevent hepatitis A and B. At this point, there are no vaccines that can prevent hepatitis C. It is very, very, very important to ask your doctor about vaccines for hepatitis A and B. These vaccines can help prevent the spread of disease and can prevent you from contracting this disease. It's very important to make an appointment with your doctor immediately if you do have any of those symptoms. That way your doctor can diagnose and treat it as needed. The next one we'll talk about is syphilis. Syphilis is a very common STD that can cause serious implications if left untreated. Symptoms of syphilis occur in 4 different stages. The first is primary, the second is secondary, the third is latent, and the last stage is late syphilis. Syphilis can be spread during vaginal, anal, or oral sex. Typically, if one contracts syphilis, sores can be found on the penis, vagina, the anus, inside of the rectum, on your lips, or inside of your mouth. There are many symptoms of syphilis, which can include rashes on your palms of your hands or on the soles of your feet, fever, fatigue, sore throat, hair loss, weight loss, swollen glands, headache, or muscle pain. The treatment for syphilis, again, it has to be diagnosed and treated by your physician. It's very important if you do have any of those symptoms to contact your doctor immediately so you can be tested and or treated if need be. The next one we'll talk about is herpes. Genital herpes is caused by 2 different types of viruses. The first is herpes simplex type 1 and herpes simplex type 2. Herpes can be spread through vaginal, anal, or oral sex with someone that's already infected. Herpes is a common STD that can affect both men and women. Many people have little to no symptoms of herpes. Those who do experience any kind of symptoms may have any of the following: sores that appear that turn into blisters on the genital area, mouth, or rectum. These sores may burst and take weeks to heal. They're typically called outbreaks. Currently, there is no cure for herpes. There's also no vaccination to prevent herpes. Herpes outbreaks may be managed with medications that can only be prescribed by your doctor. Again, with all of these STDs, they have to be diagnosed by your doctor and also treated by your doctor, with the exception of BV. If you notice any of these symptoms, make sure you call your doctor immediately and schedule an appointment to get tested. The next one that we'll talk about is HIV and AIDS. HIV stands for Human Immunodeficiency Virus, or AIDS, which is Acquired Immune Deficiency Syndrome. It is a virus that significantly impairs the body's immune system, causing it to have a lowered ability to fight off certain infections and diseases. HIV and AIDS can be transmitted by vaginal or anal intercourse or through blood transmission. Again, sharing needles is one way, other than having sex, that HIV can be contracted. Currently, there is no cure for HIV or AIDS. Many people have little to no symptoms with HIV or AIDS. Many people will go many years with no symptoms whatsoever. The only way to positively identify having HIV or AIDS is by scheduling an appointment with your doctor or going to your local health department and getting a blood test to determine so. Some people do experience symptoms. Some of these symptoms that they may experience include cough, shortness of breath, seizures and or lack of coordination, difficulty or painful swallowing, confusion or forgetfulness, severe or persistent diarrhea, fever, vision loss, or nausea, abdominal cramps, and or vomiting. A lot of these symptoms can also be conducive of other types of diseases. So if people do experience some of these, they may not directly think of HIV or AIDS as something that they would have. So it's very important to, if you are sexually active, to make sure that you're getting tested regularly. Again, you can do this at your doctor's office, or you can do it at your local health department. Treatment for HIV and AIDS, currently there is no cure for HIV or AIDS. There are no vaccines available at this time, although there is a lot of research being put forth into this effort. There's currently no vaccines or no cure. If you are currently sexually active, again, it's very important that you get tested on a regular basis. Again, you can contact your doctor or your local health department to get tested. And all of the results and the testing process itself is kept completely confidential. So none of the information is shared with family, friends, school, anyone like that. The next one we'll talk about is human papillomavirus, or most commonly known as HPV. HPV is the most common viral STD that affects both men and women. It can cause warts in various parts of the body, including the genital area. It is spread through vaginal, anal, or oral sexual contact. This virus can lead to certain types of cancers as well, including cervical cancer in women, and cancer of the vulva, anus, penis, and throat. Symptoms of HPV, many men and women don't know they have HPV. They may have it and not know it. There's very little symptoms associated with HPV other than genital warts. Only a doctor will be able to test for HPV, and only a doctor will be able to provide medications to treat HPV as needed. Currently, there is no cure for HPV. If you experience any symptoms, again, it's very important that you contact your doctor immediately to be tested. There are vaccines available to prevent HPV, so make sure you talk to your doctor at your next visit about some of these vaccines that are offered that can prevent HPV altogether. Trick is the next one. It's a very common STD that affects both men and women. The infection is caused by a parasite called Trichomonas vaginalis. It is considered the most common curable STD. It is spread by vaginal contact, either between the penis to vagina or vagina to vagina. Some of the symptoms of Trich, many people do not experience any signs or symptoms. Those who do experience symptoms may experience any of the following: itching, redness, or soreness in the genital area, pain or burning during urination, unusual discharge from the penis or vagina, and men may experience pain after ejaculation after having sex. The treatment is fairly simple. Again, it's important to talk to your doctor. Only your doctor can diagnose it, and only your doctor can treat it. There's prescription medications that your doctor can prescribe to you to take care of this STD. There's a few ways to prevent STDs. The 100% surefire way to prevent STDs is to not have any sexual contact at all. If you are sexually active, it is very, very important to use a condom every single time. It's important to use a condom if you're having vaginal intercourse, anal intercourse, or oral intercourse. Because again, many of these STDs can be transmitted in all of those ways. Getting tested routinely is also a very good way to prevent STDs. Making sure you're getting tested on a regular basis. That way, if you do have an STD, it can be treated. And again, the majority of these STDs have to be diagnosed and treated by your doctor. You can also go to your local health department to get most of these testing as well. Typically, the health department will do routine testing. Depending on where you live, some may require that you schedule an appointment. Other ones may allow walk-ins on certain days, so it's very important to call your local health department and find out their policies and procedures on STD testing. Our clinic here offers free condoms to anyone who wants them. All you have to do is ask your provider. Our providers here are more than happy to give you condoms if you need them. Typically, the health department will have condoms as well, so you're always able to get them there. You can also buy them at typically any grocery store, your local supermarket, gas stations. They're readily available. And if you are sexually active, that's one of the best ways that you can prevent STDs. And again, your test results, the testing process is kept completely confidential. So family, friends, peers at school, no one's going to know that you're being tested or the results of your test. So I have also provided a short video on STDs and how you can talk to your healthcare provider about getting tested or getting some more information.
I'm 24 years old and I am sexually active.
I'm 18 years old. I don't have a boyfriend, but I do sometimes see someone I like. I'm 14 years old. I am not sexually active.
I'm 22 years old and I am sexually active.
I think it's the physician's responsibility to make sure that we take a complete and comprehensive sexual history on all patients. But for teenagers, I do it with every visit. I say, is everything okay? Do we have any needs in regards to sexual health?
Sexual health is about having a positive and respectful and responsible approach to sexuality and relationships. You can't tell if your partner has an STD just by looking at them. Most STDs don't have any symptoms, so a good way to have a safe and healthy sexual relationship is to go with your partner and get tested before you have sex.
I had a sexual experience with my first partner and I was like, I need to tell the doctor, and I know they're going to ask if it was with a female or male, and I need to be honest. It was scary. My doctor was very cool. She calmed me down. She's like, it's okay. I see that kind of thing all the time.
So when was the last time you had sex?
It was about a month ago.
Okay. Did you have sex with males, females, or both?
Males.
Okay. And it's important at the onset of the relationship with the patient to tell them that I know that things may be embarrassing. I am going to meet you where you are, as you are, and appreciate that.
When I went to a general checkup for my doctor, it was the first time I asked about sex. So I was nervous about asking. And the reason I asked was because I was very curious.
So Madeline, today what we're going to do is do a sexual history. Okay? And the purpose of doing this.
She asked if I was sexually active, if I was dating a boy or a girl. And I said, I'm not currently sexually active. I like boys and girls, but I do not have a boyfriend or a girlfriend.
I teach physicians all the time about being as non-judgmental as possible, especially when you're talking about sex.
When I spoke to my doctor, I had a negative experience. I had a new partner and we used protection, but I developed like a rash and I just felt like I should go get it checked out. And she looked at it and she said, if it looks like a duck and it quacks like a duck, then it's probably a duck. And I just felt like that was really inappropriate. Like I left the appointment crying because I was so upset. And finally they called me back to get my actual results and they were negative.
If your doctor is judgmental when you bring it up, then you really need to think about if that is the provider for you. When I go into the room, I say everything that we're going to talk about in this room once the parent or guardian steps out is confidential, unless I think that you're going to harm yourself or others. I encourage all physicians to have policies that are posted in their office to talk about what are the confidentiality issues.
Confidentiality is really important because I know that if I were to be having sex and my mom was informed, I would be like, I'm never going to talk to you ever again. So there has to be trust.
I know sometimes people feel that oral sex is much safer, but you still can contract STDs that way as well.
STDs from oral sex?
Yes.
My doctor helped me understand that even if you're just having oral sex, you're still putting yourself at risk for HIV and for other STIs. And that was something that I didn't know before.
If anyone finds it hard to talk about sexual health with their parents, then they should definitely talk to a doctor.
Now when I talk to my doctor about sexual health, I really don't have a problem with it because I developed a good relationship with my doctor.
As a young person, you have the right to talk to your healthcare provider about your sexual health. You don't have to be embarrassed. Your provider can help you figure out for which STDs you need to be tested and also help you figure out how to protect yourself against getting STDs.
You need to talk to a person who is experienced in health. It's like, duh.
So again, talking to your provider, having that conversation is very, very important. Again, just to reiterate what was said in the video, everything is kept confidential, other than if you were to say that you were going to harm yourself or others, but your sexual history is kept completely confidential. The last thing I wanted to do was talk a little bit about sexual exposure. A lot of times when we think that we've only had one or two partners, that we're only being exposed to one or two people. However, I know it's kind of difficult to see this chart, but it kind of shows you, it goes on the side of how many sexual partners you've had to the number of people you may have potentially been exposed to. So the chart goes from 1 to 12 for number of sexual partners. And then it goes again down from 1 down to 4,095 people that potentially you may have been exposed to. So what I'd really like you to do is kind of think about how many sexual partners you've had. It doesn't have to be anything obviously that's said out loud, but just think about that and think about, for example, if you've had even 5 sexual partners, you potentially may have exposed yourself to 31 people. If you go down on the extreme end at 12 sexual partners, if you have had 12 sexual partners, you have potentially exposed yourself to 4,095 partners. Again, this is, if you have had sex with 12 people, you don't know who those 12 people have had sex with. So again, that could potentially be upwards of 4,000 people. So this chart's kind of a little bit of an eye-opener to see, even though you may be in a committed relationship, that still can open up the door for exposure. If you'd like any more information, all of this information that I have provided today was received from the Center for Disease Control and Prevention. I've provided the website on there as well, and I've also provided the website that I got the chart off of that we just looked at before. So again, my PowerPoint presentation has been uploaded to Blackboard as well. So I apologize that I know it's probably impossible to see this, but the PowerPoint is attached. Thanks.